السلام عليكم ورحمة الله وبركاته. أهلا بكم طلبة الفرقة الأولى كلية طب الأسنان الأعزاء، دفعة الحبيبة ودفعة التحدي ودفعة الكوفيد 19، وأكيد الموديول دوت اللي هو الثوركس مناسب جدا للأحداث اللي بتواجه العالم كلها وهي الكورونا فيروس، لأنه هو الخوف كله من الريسبيراتوري انفكشن ومن إن الكورونا فيروس يدخل عن طريق الريسبيراتوري ايرويز ويستقر في اللنج ولا قدر الله يعمل ريسبيراتوري فيلير. فالموديول دوت هتدرس فيه الثوراسيك وول والثوراسيك كافيتي، ونقصد بالثوراسيك كافيتي الأشياء اللي موجودة فيه وهي التو لانجز والهارت في النص. طيب خلونا نبدأ في الثوركس. يا ترى فين الثوركس بتاعنا؟ طبعا الثوركس this is the part between the neck and the abdomen، ما بين النك والابدومين. this is the part of the body which is called the thorax. في ايه في الثوركس؟ في 2 لونج على الرايت والليفت lateral side، وفي النص في الميديان part الهارت موجود والبيج بلاد فيسلز اللي بيخرجوا منه. طبعا الثوركس is very important for your health، وبيأثر على الاوفر اول هيلث للبادي كله. كل ما بتعمل سبورت انت بتنشط الدورة الدموية بتاعتك، بتنشط الهارت، وبيبدأ الجسم كله يتفاعل بطريقة بوزيتيف مع السبورت. زي ما قلنا الثوركس هندرس فيه الثوراسيك كافيتي، والثوراسيك كافيتي نقصد بيه الهارت واللنج، وهندرس الثوراسيك وول، والثوراسيك وول نقصد بيه البون والمسلز اللي موجودين في الثوراسيك وول. طيب what about the thoracic wall? What are the boundaries of the thoracic wall? The boundaries of the thoracic wall, anterior here we have this bone which is the sternum. This is the anterior boundary of the thoracic wall, and posterior we have the vertebral column, the structure which is support your back from posterior side is the vertebral column, and on each side we have the ribs and the costal cartilage. Okay, so the boundaries of the thoracic wall: anterior sternum and costal cartilage, posterior the vertebral column, and on each side the ribs and the intercostal spaces. This is a picture of the thoracic cage. The anterior boundary of the thoracic cage, as we mentioned, is the sternum, and the posterior boundary is the vertebral column, and on each side we have the ribs and the costal cartilage. Okay. What are or what is the main function of the thoracic cage? Of course, it's protection. So protects the thoracic organs, which are the lung and the heart. And also it's very important in the respiratory process. We will begin with the anterior boundary of the thoracic cage, which is called the sternum. The sternum is composed of, anatomically, it's composed of 3 different parts. The first part is called the manubrium sterni. This is the first part of the sternum. The second part is the body of the sternum. This is the body, and the last piece here is the xiphoid process of the sternum. What about this attachment here, or this junction here between the manubrium sterni and the body of the sternum? This is called sternal angle, and it's very important anatomical landmark. So the manubrium sterni is the superior part, the body of the sternum, and lastly the xiphoid process. And don't forget the sternal angle between the manubrium sterni and the body of the sternum. The sternal angle is the site of attachment of the second costal cartilage and the second rib. So here you could identify the second costal cartilage and the continuation or the posterior continuation of the rib, the second rib. So the sternal angle is very important because from here you can count the ribs and the intercostal spaces. How this happens? If you put your index finger in the root of your neck here, you can easily feel the suprasternal notch. So if you put your index, put it now, if you put your index finger here in this place, you can find a notch called the suprasternal notch. And then if you move downward in the midline, exactly in your midline, part of your anterior chest wall, so you are moving in this direction here. This is the manubrium sterni, and you're moving your index finger on the anterior surface of your manubrium sterni down to reach a transverse ridge. You can feel this transverse ridge. You can train yourself to feel this transverse ridge between the manubrium sterni and the body of the sternum, and here you could identify the attachment of the second rib. So here you could find the second costal cartilage and the second rib. And from this level, or from this point downward, you can count the spaces and different ribs. So this is the second, and this is the attachment of the third, and between the second and third, this is the third rib, and here this is the second. Each space is lying down or inferior to the rib. So the second rib and second space, third rib, third space, fourth rib and fourth space, and like that. So if you reach the level of the sternal angle, this is the level of the second costal cartilage and second rib, and below this second rib, the second space, and the bony prominence below this second space will be third rib, and like that. If you count, you will be going like that. And this is a side view of the sternum. Here, this is the side of the sternum, manubrium. This is the manubrium, and this is the body here, and last piece is this void process, and this is the sternal angle. So if you go like this, if you put your finger here, so you can feel here in the suprasternal notch, and going in the midline until you reach this transverse this transverse ridge. This is the sternal angle, and this is the site for attachment of the second rib, and just like the second rib, the second space, and third rib and third space, fourth space, and go on. We classify the ribs in two ways, according to the attachment of the rib to the sternum, and also according to the shape of the rib itself. So how can we classify the ribs according to the attachment to the sternum? We have true ribs and false ribs and floating ribs. It is a very simple way of classification of the rib. Now we will divide the ribs according to their attachment to the sternum and the body of the vertebra. We are classifying the ribs into three types: true ribs, false ribs, and floating ribs. So we have in the center here the manubrium sterni. This is the manubrium sterni here, and this is the sternal angle, and this is the body of the sternum here. And the body of the sternum continues with the xiphoid process, which is the last piece of the sternum. Here is the sternal angle, and this is the point of attachment of the second rib. So here, the second rib and the second costal cartilage on each side. Here is the first rib and the first costal cartilage attached to the manubrium sterni, and it curves posterior to be attached to the side of T1, the thoracic vertebrae number 1. Also in the manubrium sterni, here is the attachment of the clavicle in the sternoclavicular joint. So this is the sternoclavicular joint, where the clavicle is attached medially to the manubrium sterni. and the first rib is attached just below the sternoclavicular joint to make the first costal cartilage attachment to the manubrium sterni. So this is the first rib here, this one, and this is the second rib. And below the second rib we start counting second space and then third rib on each side, and this is the fourth rib and fourth costal cartilage. Below the fourth rib we will find the fourth space, fifth rib, like that, and the sixth rib, and here at the junction between the body of the sternum and the xiphoid process is the seventh rib. This is the sixth rib on the opposite side, and this is the seventh rib. So this is here third rib and third space and third costal cartilage, sorry, and this is fourth rib and fourth intercostal cartilage, fifth rib and fifth intercostal cartilage, and this is the sixth rib and sixth intercostal cartilage, and sure this is the seventh rib and seventh intercostal cartilage, seventh costal cartilage. So this is the costal cartilage like this in the blue color, and the rest of the rib is the bone of each rib. From first rib to the seventh rib, we call these ribs are true ribs. Why we call these true ribs? Because they have posterior end which is attached to the side of the vertebrae, and anterior end is attached to the side of the sternum by a costal cartilage. What about the following ribs? So we have, this is the 8th, this is 9th rib, and this is 11th rib. You can see all these ribs are joining together to form one costal cartilage. This costal cartilage is joining the costal cartilage of rib number 7. So this 8 and this 9 and this 10th. All these costal cartilage of these three ribs are joining together, and they are joining the costal cartilage of the rib number 7. So we call these three ribs false ribs. Why do we call them false ribs? Because they are joining together, the costal cartilage of these three ribs are joining together, and all are joining the costal cartilage of rib number 7. So we call them false ribs. What about the rib number 11 and 12? They only have a vertebral attachment. It does not have a costal or a sternal attachment, so it is only attached to the sides of vertebra number 11 and 12. So this is T12 and the upward is T11, and the ribs are just attached to the sides of these vertebrae, so we call them floating ribs. We call them floating because they are floating on your posterior wall, and they are nearly straight, does not have sternal end, so we call them floating ribs. So when you classify ribs, just remember to classify them according to the attachment of the rib to the vertebra and to the sternum into true ribs from rib number 1 to 7, and then false ribs, number 8, rib number 8, rib number 9, rib number 10, and the last two are called floating ribs. They only attach to the sides of the thoracic vertebra number 11 and 12. Now, what about the classification of the rib according to the shape or the anatomical features of the rib? We have a typical rib and atypical rib. Typical rib composed of head, neck, tubercle, angle, shaft or a body, and subcostal groove. Also, it has a superior border and inferior border and two surfaces, outer surface and inner surface. Okay, so let's see the picture of a typical rib in the following slide. This is the typical rib. The typical rib, as we said, composed of this part here is called the head of the rib, and the constriction just behind the head of the rib is called the neck of the rib. So this is the neck of the rib, and the process just behind or just anterior to the neck of the rib is called the tubercle of the rib. As you can see, we have two parts of the tubercle, a bony part and a facet. And this is the shaft of the rib here. This is the shaft of the whole rib. And this is the anterior end of the rib, which is the costal end of the rib. So this is the costal end of the rib. Here you can identify the maximum point of convexity between the posterior and anterior parts, which is called the angle of the rib. So you have head, neck, tubercle, angle, shaft, and a costal or anterior end. As you can see, this is the head of the rib, which contains two articulating facets. Sometimes we call it demifacets. This is the superior and this is the inferior facets. Why do we have two articulating facets of the head of the rib? Because each rib articulates with two vertebrae. Each rib articulates with two vertebrae. A vertebrae which is corresponding in its number. So if this is the rib of number 6, the vertebrae which should be here is the vertebrae number 6, T6. So T6 will articulate with the inferior facet of the corresponding vertebrae, which is rib number 6. And above vertebrae, the above vertebrae should be the vertebrae number 5. So each rib articulates with the sides of two vertebrae. It has two facets. The lower facet articulate with the side of the corresponding vertebrae, and the upper facet articulate with the side of the above vertebrae. And also the transverse or the tubercle of the rib here has a facet. This facet is for articulating with the transverse process of corresponding vertebrae. So if we draw just simple diagram like this, this is the transverse process of T6. So the T6 articulates with the facet on the side of the tubercle of rib number 6, and this will be more clearly shown in the next slide. Okay, this is the rib number, say this is rib number 6 and this rib number 7. Between rib number 6 and rib number 7, this space is the intercostal space of number 6. This is a 6 space. Okay. Okay, so as you can see, the superior border of rib number 6, and this is the inferior border of rib number 6. Near the inferior border of rib number 6, we have a very important structures here. They are called from superior to inferior vein, intercostal vein, intercostal vein, intercostal artery, and intercostal nerve. They are arranged like that from all subcostal grooves. So they are running in a groove, this groove near the inferior border of the rib, and this groove is called subcostal groove. It contains the three intercostal structures from above downward, intercostal V, which is representing the intercostal vein, then the intercostal artery, and lastly inferior the intercostal nerve. Okay, what is the importance or the clinical importance of the subcostal groove and subcostal vein? Sometimes we have a phenomena called pleural effusion. What is this pleural effusion? You know, this is the lung here, the lung represented in the lateral cavity of the chest wall, and the lung is surrounded by a membrane, very delicate and thin membrane, double layered, called pleura. This pleura here has a cavity. The cavity of the pleura contains a very little amount of fluid called pleural fluid, and this cavity or this fluid just to lubricate the two layers of the pleura, so it facilitates movement or the sliding movement of the two layers of the pleura, and this fluid is very minimal, so it is not a large amount. Sometimes we have a condition known as pleural effusion. If we increase, if this fluid increased to any cause, due to any cause, just like inflammation or infection, so this fluid accumulates much more than normal around the lungs, and this cause pressure or compress the lung. It does not allow the lung to be flexible in movement and restrict the respiratory movement, and sometimes make severe distress. So the only solution for this is to withdraw the collected fluid between the two layers of the pleura. How to withdraw this fluid? By using this type of a needle. So where do you or where should you insert this needle? Should you insert the needle here or here? I mean, should you insert the needle near to the upper border of the rib or near to the lower border of the rib? The correct answer is that you should insert the needle near to the upper border of the rib. Why? To avoid injury of the important structures which are situated near to the lower border of the rib, which are the three veins. This picture shows the first rib and second rib, which are atypical ribs, and this is the number of atypical rib, and this picture shows the difference. It's not important for you to distinguish the features of first and second rib. Okay. What about the vertebral column? The vertebral column is situated in your back, in the middle of your back, and you can feel the vertebral column if you move your finger, index finger or your thumb finger in the middle of your back. You feel a projection. This projections corresponding for the spines of the vertebra. So the vertebral column is composed of 33 vertebrae, and they are divided into 7 in your neck, so they are 7 cervical, and 12 in your thorax, in the back of the thorax, 12 thoracic, and 5 lumbar in your back of your abdomen, and 5 pieces fused together forming sacrum, and also 4 pieces fused together, they are forming the coccyx. And this is the this picture showing the typical vertebrae. The typical vertebrae is composed of a body and the arch. Now we will draw a very simple picture to show you the anatomical or the different anatomical parts of the typical vertebrae. So each of the typical vertebrae is composed of a vertebral body anterior and a vertebral arch posterior. So let's say this is the vertebral body, and this should be anterior, and the vertebral arch will be like that. We will discuss all these processes when we finish. This is called spine, and this is the transverse process here. Let's draw it in an easy way, like that. this is a transverse process of the vertebrae, and this is called vertebral arch, directed posterior, and this is the vertebral body, directed anterior. Between the vertebral body and the vertebral arch, we have the vertebral foramen. This is the vertebral foramen. This foramen for passage of the spinal cord. This is called vertebral foramen for the passage of the spinal cord. Okay. Okay, so this is the vertebral body, and this is the vertebral arch. The vertebral body is connected to the vertebral arch via this part of the bone. This part here is called the pedicle of the vertebrae. So this is a part of the vertebral arch which connects between the vertebral body and the vertebral arch posterior, and it's called a pedicle. Pedicle. What about the vertebral arch itself? The vertebral arch itself composed of 7 processes. 2 of them are called transverse processes. Transverse. This is one, and this is the other one. And one is directed posterior here. It's called the spine, and you can easily feel the spine projection at the middle of your back. And we have another 2 which are directed superior to articulate with the superior vertebrae, and this is called superior articular processes. And we have another 2 like them exactly, but we cannot draw them from here because we are looking to the vertebra from above. They are called inferior articular processes. So we have 4 articular processes. Articular processes. 2 of them are superior and 2 of them are inferior articular processes, and we will mention them in the following picture. As you can see here, this is the body of the vertebra, this is the body, and this is the arch of the vertebra. Between the body and the arch, this is the vertebral foramen for passage of the spinal cord, and the arch itself contains 7 processes. 2 of them are transverse processes, 1 is the spine, and 4 superior, 2 superior articular processes, and inferior articular processes, they are 2 as well. Between the vertebral body and the vertebral arch, we have the vertebral foramen for passage of the spinal cord. And between the sides of the vertebrae, we have the intervertebral foramen, and the intervertebral foramen, as we will see, allows the spinal nerves to emerge between the sides of the 2 vertebrae. Here, this is a comparison between different types of vertebrae: cervical vertebrae, thoracic vertebrae, and lumbar vertebrae, and it's not important for you to know the details of the difference between all of these vertebrae. We have a very important classification of the thoracic vertebrae into typical and atypical vertebrae. If you remember, we have a classification of the ribs into typical and atypical ribs. This also is a simple classification for the thoracic vertebrae. The typical thoracic vertebrae is from the 2nd to 8th vertebrae, so first does not be considered as a typical vertebrae, and the atypical vertebrae is the first one, 9th one, 10, 11, and 12. And also it is not important for you to know the anatomical difference between these vertebrae. This is a picture of the typical thoracic vertebrae. This is a vertebral body. As you can see, this is the vertebral body, and this is the vertebral arch directed posterior. Here, this is the pedicle which connects between the body and the vertebral arch, and the arch itself composed of 7 articular processes. Two of them are transverse. This is one transverse and this is other transverse. This transverse process. And this is the spine. And here, this is the superior articular facets. Two superior articular facets. And we have another two if you look to the vertebra from the inferior surface. This bone here, this part of the bone is called lamina of the vertebrae. We have two lamina of the vertebrae. So the lamina is the meeting between the two transverse processes when they meet the spine. We have this part here is called lamina and the other one here is called the lamina. So the lamina are forming the spine of the vertebrae, and this is the vertebral arch for passage of the spinal cord. Okay. You can see here, this is the intervertebral foramina here. These intervertebral foramina allow passage of the spinal nerves. So the spinal nerves are coming from here and they are innervating muscles and skin of the corresponding part of the thorax. And this is the side view of the vertebra. Here you can see the superior articular processes. These are the two superior articular processes and these are the two inferior articular processes. Superior articular processes for articulation with the above vertebrae, and the inferior articular processes are for articulation with the below vertebrae. As you can see here, this is the superior articular process of this vertebra articulating with the inferior articular with the above vertebrae, and the inferior articular facet of, or the inferior articular process is articulating with the superior articular process of the above vertebrae. This is another picture to show you the different anatomical parts of the vertebrae. Okay, we have a very important mark or a very important anatomical structure which lies between the two vertebrae. We call it intervertebral disc. So this is the intervertebral disc. The intervertebral disc allows the vertebral column to move free between different movements. So it allows easily flex or extend your vertebral column. It's histologically composed of outer part. This outer part is fibrous in structure and it's composed of different circles or like this, circles of fibrous tissue, and it's called annulus fibrosus. And inside material, this is gelatinous material here, and this is called nucleus pulposus. So you see, this is gelatinous material inside the structure of your intervertebral disc. Sometimes you have a compression or a congenital anomaly in this disc, intervertebral disc, leading to something called rupture of this disc, which usually happens in the posterolateral direction, and the inside material, which is the nucleus pulposus, comes in the posterior way to compress the spinal nerve which emerges from the intervertebral foramina, and this leads to clinical picture of the ruptured or the intervertebral disc prolapse, which include, for example, if this occurs in the sciatic nerve in the lower limb, it will cause numbness and weakness of the muscles, as you studied in the section of the lower limb. What about the openings of the thorax? We have a superior opening of the thorax and inferior opening of the thorax. This is the superior opening of the thorax, which is called thoracic outlet, and this is the inferior opening of the thorax, which is between the thorax and the beginning of the abdomen. The superior opening of the thorax is called thoracic outlet, and it is very important anatomical landmark. The thoracic outlet is the opening of the chest, the opening of the chest between the chest and the root of the neck, and the inferior thoracic aperture is the opening or the meeting point between the thorax and the abdomen. The thoracic outlet includes structures very important, such as the esophagus. This is the esophagus here, and this is the trachea in front of the esophagus, and these are the main blood vessels that emerges from the heart to the root of the neck. What is the boundaries of this thoracic outlet? Anterior, this is the manubrium sterni, anterior, and posterior here in the back is the body of the first thoracic vertebrae, and on each side here the first rib. So the boundaries, these are the boundaries of the thoracic outlet. Okay, the inferior thoracic apertures, anterior is bounded by xiphoid process of the sternum, posterior is bounded by the 12 thoracic vertebrae. Okay, this clinical picture is called thoracic outlet syndrome, and it is not very important to you to know the details of the thoracic outlet syndrome, but for those who are interested to know this clinical manifestation, we have an extra rib. This extra rib emerges from or attached to posterior to the body of the last cervical vertebrae. So it is an extra rib, is not present in let's say 99% of population, and anterior it is attached to the first rib, as you can see here, by this ligament. And it is important because here you have a very important structures passing here on the superior surface of the first rib, which are the subclavian artery and the subclavian vein and a nerve as well. And in case of presence of this cervical rib, it will make pressure on these structures, which will affect the clinical manifestation. Okay, what about joints of the chest wall? They are very easy. We have here attachment between the costal cartilage and the side of the sternum, and we have here attachment between the costal cartilage and the rib itself. Posterior, we have joints between the rib and the side of the vertebrae, and also between the rib and the side of the transverse process of the corresponding vertebrae, as we will see in a minute. Okay, so the most important is the articulation between the rib and the vertebrae. As we said, each rib is articulated with two vertebrae. Each rib, the head of each rib, is articulating with two vertebrae. So each rib has a superior and inferior demifacet on the head of the rib. The inferior demifacet is articulating with the corresponding vertebrae, and the superior demifacet is articulating with the above vertebrae. What about the tubercle of the rib? The tubercle of the rib here is articulating between the tubercle of the rib and the numerically corresponding transverse process of the vertebrae. Let's say this is the rib number 6, so this will be vertebrae number 5, and this will be vertebrae number 6, and of course the transverse process of vertebrae number 6 will articulate with the tubercle on the rib number 6. It's very important to know how this articulation happens. So you can see here, this is the head of the rib here, and the head of the rib is articulating with the numerically corresponding vertebrae. So if this is the inferior demifacet, so this shows how the inferior demifacet of the rib is articulating with the corresponding vertebrae, and this is the tubercle of the rib articulating with the transverse process of the corresponding vertebrae. So if this rib number 7, this should be vertebrae number 7, and it also will articulate with vertebrae number 6, and this is the transverse process of the numerically corresponding vertebrae number 7. Okay, and these are the joints which we mentioned before. This is the sternocostal joint between the sternum and the costal cartilage, and the costochondral joint between the costal cartilage and the bony part of the rib itself. What about the intercostal muscles? We have 3 types of intercostal muscles. The first one is called external intercostal, the second one is called internal intercostal, and the third one is called innermost intercostal. So they are arranged as layers. So the external intercostal, the direction of the muscle is downward and forward. So let's say this is the external intercostal, so the direction of fibers will be like this, downward and forward. This is the first layer. The second layer is the internal intercostal. The direction of the muscle fibers are in the opposite way, so they are directed downward and backward, like this. This is the internal intercostal. They are directing downward and backward, like this. And the innermost intercostal is the inner layer of the muscles, and sometimes it crosses more than one intercostal space, and all these muscles allow respiration to happen, and they are all innervated by intercostal nerve. We have a very important muscle of respiration called the diaphragm. What is the diaphragm? The diaphragm is the principal muscle of respiration, and it's present between the thorax and the abdomen. It has different origins. We have origin from the sternum itself, and origin from ribs, and origin from the vertebral part, or the vertebral bodies. We have sternal part, costal part, and vertebral part. And all these different parts are inserted in something called central tendon. Central tendon is the insertion of the diaphragm, as we will see in the next slide. Because the diaphragm is considered as a respiratory muscle, so it is innervated by a motor nerve. This motor nerve is called phrenic nerve. So the phrenic nerve is supplying the diaphragm on each side. As you can see here, this is the diaphragm, or the different anatomical parts of the diaphragm. We have, as we say, the sternal part. The sternal part arises from the posterior surface of the xiphoid process. So this is the sternum, and this is the posterior part of the xiphoid process. So here you can see this is the origin of the sternal part of the diaphragm, and the costal part of the diaphragm. This is the costal origin of the diaphragm from the costal margins of the ribs, and the vertebral part. The vertebral part arising by something called crura and arcuate ligaments. So what is the crura and what is the arcuate ligament? The crura, we have left crus and right crus. The right crus from the sides of the first 3 lumbar vertebrae and intervertebral disc. So this is the right crus of the diaphragm, arises from the body of the first 3 lumbar and their intervertebral disc, and the left crus of the diaphragm arises from the body of the 2 lumbar vertebrae and their intervertebral disc. Okay, this is the crura of the diaphragm. So the crura meets in this part here. This is the crura which meets here. This is the esophageal opening. So here the esophagus penetrates from the thorax to the abdomen. So the right and left crura meets around the esophageal opening. And you can see here, this is the crus here. This crus here is called median arcuate ligament, and this is the lateral arcuate ligament, which surround posterior abdominal wall muscles, and the medial arcuate ligament. This is the medial arcuate ligament, and this is the lateral arcuate ligament. The right crus and the left cross forming a tendon or surrounding the esophageal opening into the diaphragm. And this is the impression here of the liver. So the liver should be here, and here on the left side, as we will discuss in the abdomen, is the impression for the stomach. Now we will describe the blood supply of the intercostal spaces. You have to differentiate between the blood supply of the intercostal spaces from the anterior view and from the posterior view, because they have different origins. So this is the front of the chest cavity and the front of the intercostal spaces, with the muscles in between the intercostal spaces. As you know, it is almost all covered by the intercostal spaces, the intercostal muscles. So we have an artery called subclavian artery. The subclavian artery, let's say this is the subclavian artery here, which takes origin from the aorta, the arch of aorta. It gives a long branch which descends on the anterior wall of your chest cavity. It's called internal mammary artery. So this is the internal mammary artery. This is the subclavian artery. And this is the internal mammary, or sometimes we call it internal thoracic artery. The internal thoracic artery divides behind the costal cartilage of rib number 7 into musculophrenic and superior epigastric artery. So this is the musculophrenic artery, and this is the superior epigastric. Okay, the internal mammary artery is responsible for supplying the anterior part of the chest wall, the intercostal spaces, up to the 6th intercostal space. So it supplies the anterior part of the chest wall from intercostal space number 1 to the intercostal space number 6. Downward, the intercostal space number 7 and 8 and 9 are supplied by the musculophrenic artery. Okay, so we have two blood supply. All are originating from the same artery, which is the internal mammary or internal thoracic artery. The internal mammary artery supplying the intercostal spaces from number 1 down to number 6, and the musculophrenic artery supplying number 7, number 8, number 9 spaces. Okay, what about the posterior part of the thoracic cavity? The posterior part of the thoracic cavity, let's say this is the vertebral column here, the thoracic part of the vertebral column, and we have the descending thoracic aorta near to the thoracic part of the vertebral column. These are the attachment of ribs posterior. Let's say this is T1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and all these ribs are attaching posterior here. So you have a very important artery descending on the posterior aspect of the chest called thoracic or descending thoracic aorta. The aorta itself, before it curves backward to supply the posterior part of the thoracic cage, gives the subclavian artery. The subclavian artery, the first part of the subclavian artery, gives a branch called costocervical trunk. Let's say this is the subclavian artery here, and this is the costocervical trunk. The costocervical trunk curves backward and gives origin to the superior intercostal artery. The superior intercostal artery gives the blood supply to the first and second spaces. So this is the first space, this is the second space are supplied by superior intercostal. Superior intercostal is a branch of costocervical trunk. The costocervical trunk is a branch of the first part of subclavian, and this is the artery which supplies the first and second spaces from posterior view. And then from the 3rd to the 11th space, the descending abdominal aorta is supplying all these spaces. So from 3rd space, 4th, 5th, 6th, down to the 11th space, supplied are all supplying by descending thoracic aorta. And that's all to know about the blood supply. So you have here from 3rd down to 4th, 5th, 6th, 7th, 8th, 9th, 10th, 11th space. You have down, all the way down are supplied by the descending thoracic aorta on both sides. Now we have reached to the end of our presentation, and the last 3 slides in your PDF will show you the congenital anomalies of the chest wall, and they are not important for you to study these slides, just for your information. I hope you were interested in this information, and hope to see you in the second online lecture, which will discuss the chest cavity, the lungs, and the heart. Thank you very much.